we're forecasting here at the University of Washington, for everybody that's watching, business leaders across the country, 10,000 weekly deaths week over week, overwhelmingly amongst the unvaccinated because of the Delta variant. Truth is, Omicron, if you were to be exposed to it and you're unvaccinated, what we know is that it's probably at least as lethal, if not slightly more lethal, to the unvaccinated, because more of that specific version of the virus builds up in your body, more of it in your body, more likely you are to see me in a hospital setting. But I'm really glad, Brian, that you pointed out the headlines about keeping folks who are vaccinated out of the hospital, even if you're exposed to this variant. Because you're right, we have lost the plot here. It's no longer appropriate to be looking at daily case rates. Looking at hospitalizations is really going to be key, especially amongst those that are fully vaccinated. Because what we know is that the vaccines against a contagious respiratory virus, those vaccines are holding up against the thing that they should be holding up against, which is keeping folks out of the hospital. That's why we vaccinated against flu. That's not why we're going to be vaccinated against COVID, not to prevent a positive test, keep you out of the hospital. That's what endemicity looks like.
Dr. Gupta, and there's going to be, if you ever, not saying they have to look at my Twitter feed, but if you do, you'll see that I've been talking to folks like yourself and putting this out there and taking some heat for it. And people are going to think I put you on because we share that view, but nobody cares what I think. It's what you think. You are the doctor, and I'm glad to hear you say it. Case counts. To your point, when we get into the endemic stage, we don't talk about daily case counts of pneumonia or the flu, and I'm not comparing the two. This is far more serious, but it's like this obsession with case numbers. I just don't want to die from it, right? I don't want to be hospitalized or have long COVID or severe outcomes. And some of the data points that we are seeing, it's early on Omicron from vaccines, they're decent. Are they not?
Absolutely. They're reassuring. And unfortunately, a lot of, not CNBC, not NBC family, but other media headlines like to put out there that the vaccines are less effective than they are when it comes to the thing that matters, which is keeping folks out of the hospital. I hate to say this to all the viewers out there, but you're not going to necessarily be invincible from a positive test for mild symptoms. We are exposed, Brian, to a host of respiratory viruses every given cold and flu season that we don't even think about, because maybe at worst it causes a sore throat, some sniffles. That's what COVID's going to be like. Omicron, Sigma, Theta, well into 2022, whatever is down the pike for us. That's what this threat's going to look like. It's going to be a nuisance for those double, triple vaccinated. Also, by the way, it's important that the CDC, FDA, if they're watching right now, they need to update the definition of fully vaccinated because businesses across the country develop protocols and procedures for their staff, for their workforce, depending on what the CDC says is fully vaxxed. And if we're pushing the booster because we think that actually you need 3 shots to stay out of the hospital, then let's call it such so that businesses can really plan here. And that's a key gap.
And that is, and Dr. Gupta, I know we've got to go. I got to ask you this very quickly here. From hospitalization rate, the point is, hospitalizations are the key, but do we also need to change the definition of a COVID, quote, admission? We had a doctor on yesterday saying, and my friend is an ER doctor in my town. I talk to him a couple times a week. Half the people coming in for COVID are coming in literally with panic attacks because they get the sniffles and they're terrified that they're going to die of COVID. And they have to talk them down in the ER. I'm not joking.
I do think that the New York Times, other websites that are constantly presenting case counts, we need to move away from that to how many people are having COVID breakthrough disease requiring hospitalization. That is going to be an important metric, in addition to how many deaths are happening, how many hospitalizations are happening amongst the unvaccinated. Those are meaningful data points. Those are the things that we have to keep our eye out on. Everything else is just noise, and it's going to distract us.